I'm going to ask the panelists to come up to the table. And while they're coming up to the table, I'm going to ask Robin Cooper to make a few comments. And Robin, why don't you introduce yourself?
Sweet. I'm Robin Cooper. I am a psychiatrist, and I think I'm up here just like David Lobel to show you that psychiatrists are involved and we have a voice in this process, just like you're a dad. I want to thank you. I finally got screens for my windows, and I'm pleased because in San Francisco we have not needed screens previously. I had a number of ideas that I wanted to share, and I had written them out, but it's been covered largely, the profound impact from a mental health and psychiatric point of view of PTSD and depression in children who are exposed to the traumas repeatedly. And I just want to just 1 minute report to you this heart-wrenching story in the Washington Post of a kid last week at the as they're reviewing the impacts of Hurricane Harvey, with a child terrified when it started to rain and asking his mom, are we going to lose our house again? So I think we're seeing those very, very human ways that trauma and depression affect kids profoundly. The other thing that you've spoken so incredibly about is the toxic exposures and the air pollutants, and on the profound impact on just the neuropsychiatric and developmental impacts on children. And those are the foundations of being able to think and learn. And we know if children don't think and learn, they're impaired throughout their life in very profound ways. But you guys have done a much better job than I can on all of those things. So I'm going to add just one more area of concern. This conference said what we do not know about. And what we do not know well enough about in the field of mental health and psychiatry is, what is it like for our children up in a world where they're constantly confronted with the idea of existential threat, the idea that we may not have a world for them to grow up in. What does that do to their psyche? We don't know that completely. We have clues. We have clues from war-torn areas where kids become susceptible to being drawn into terrorist groups as child soldiers, expendable child soldiers. We know something about how poverty impairs the sense of being able to grow up into a world that kids can contribute to, with profound despair, and how that leads to possibly hopelessness. We know kids are worried, and I want to thank you for the work you're doing with our Children's Trust, which is a legal suit to the federal government that says the government is not protecting the rights for children to grow up in a safe, a climate-safe environment. We know the children are worried. And what does that do to their psyche and sense of growing into a future world? I'm with a group called Climate Psychiatry Alliance, my colleague there. We show you we are psychiatrists here with you. And our mission is to talk about the mental health and psychiatric impacts. Michelle wanted us to address solutions. I'm also an activist. Dick, I want to thank you for all of your contributions on everything today, but I think you mentioned that there's a reason that policy and politics have the same root. And I think one of the things you mentioned is how to get fossil fuels no longer subsidized. It's a particularly important political idea that I'm just speaking of here, but there are many other, and David was also going to speak a little bit about some solutions.
Just a few seconds, because we have to get some. Yeah, thank you.
Just one thing that we try to emphasize in a lot of what we present is, if we don't do a lot of the changes that we're talking about, future generations will be able to charge us with, in effect, generational child abuse. And we should take that into account in terms of what we're doing. In terms of some concrete things that we can do, in addition to what you all have said in relation to the specific agents you've talked about, one relates to temperature increases. I don't think we today, but the children are as at risk of increased temperature problems, which are dehydration and hyperthermia, and we have to help protect them. More importantly, in terms of their psychological sense of well-being, both the trauma, the toxic stress that
Yes,
Dr. Burke-Harris was describing,
Nadine.
and a number of other things. We have to be clearly showing our children that we care and that we will protect them. They need that assurance that we will be there, and that even though their world is changing, we have to help them understand that it is changing and why. Finally, we need to develop really rapidly a lot of community-level public health interventions to help communities be prepared to intervene and to stay healthy in the process, to prevent and mitigate climate change, but also to be psychologically healthy and to not get demoralized.
Thank you. I think that's a nice segue that we'd like to ask each of you, since you so beautifully presented your science, if you could make a comment on how you can use your science to advocate better for, because we're sort of talking to the choir here. How do you use your science to come up with a positive solution to mitigating climate change?
So one thing that I didn't have a chance to talk about, but affects actually all of our areas, and I think you alluded to it indirectly, is, again, well, I did allude to it indirectly, is that political will really spurs action, right? So if you can really make the business case to governments and to large international organizations, they will make changes. You know, I work in the eradication of polio, so I can see a disease that clearly I think this is important, but why, we could have done that with many other diseases as well, and it would probably have been, frankly, less expensive. And I have to say that even though that's been my career, one of my areas of interest, we could have done that with other areas. And the reason I bring that up is if you look at what economists have been doing around modeling of the impact. So for example, if you look at the impact of cleaning up your water supplies, you get 100-fold ROI on cleaning up your water supply. You can get anywhere from 10 to 100-fold. So if you can convince countries and governments and international organizations they're going to get their money back, and that it's going to be something that is worthwhile to their population. That's one area. The other one is that we know from the pediatric perspective now that when you follow any traumatic event for a child, and I don't know about toxic stress necessarily, but for infections, other traumatic illnesses, those always have an impact on the neurodevelopmental outcome of children, always. I mean, we're starting to see that they're all linked, and some of my colleagues at Harvard, economists at Harvard, have really looked at these indirect effects, and they say that some of these can actually wind up costing trillions of dollars in terms of economic productivity for countries. And that's where we really need to make the case. That's what made the case for vaccination. And even just, in the US, getting chlorinated or cleaned water, and I know I'm afraid to say chlorine, but clean water and public health systems, because the return on investment was so great. And that's where I would focus, is getting that message and making it about science. I think David said science is critical.
So, Ricky, you presented beautifully on your cohort, and actually watching those two cohorts and seeing the difference. Can you use that evidence, and how can you advocate better to make a difference?
Of course. I think one of our failings in the past, am I okay? You can hear me? One of our failings as scientists is we have not been good communicators, and we need to do that at all levels. So we have a community outreach translation core at our center that provides information to the participants in the cohorts, to the families, and the community. And we do it in several languages because English isn't always the first language. And then, so at that level, to inform the people who are most directly involved and to empower them. And the next thing is we have worked with community groups to inform our local policymakers, city council and other members of government, about our findings, and what they need to do and can do about the problem. And I think that's really very important. And then, as I mentioned in my talk, to be able to quantify the health costs, the immediate and long-term health costs to children from pollution, climate change, and the economic costs, which you've so beautifully expressed, and to bring those numbers to bear, because that will make a difference. And we estimated using the data from our New York City cohort that just bringing down the levels of air pollution, a small amount, entirely feasible, the small amount of PAH in air in New York City would gain IQ points, would gain a great boost in lifetime earnings for each birth cohort, each year's birth cohort, and the gains amounted to millions of dollars for each year's birth cohort. And that's had quite an impact.
Mm-hmm. So, David, you so beautifully talked about how food security can be endangered by climate change. And you alluded to, and we didn't get to ask many of the questions, how we're on the edge of a technological bullet with CRISPR and BT, yet we have so much pushback about GMOs, about genetically modified food. Can you talk a little bit about how that is going to play out to make a difference?
How will it play out? I mean, I think there's, in my mind, there's kind of two needs. One is to keep increasing the evidence base to make good cost-benefit calculations. And I think on that front, I'm fairly optimistic in the sense that the data and the evidence are getting easier and easier to come by. We saw several examples of that today. If you look, we were just talking about the lagoons and the extreme events. There's actually, we had a postdoc studying this issue because now there are data about health outcomes available, which you can merge and compare to all sorts of locations of lagoons, which you can detect now from satellite, and you can start to study that problem. Or mental health we just heard about. There's a colleague in our center, Marshall Burke, who's taken a lot of health outcomes around suicides, depression, all sorts of mental health issues, and shown the direct effects of temperature. The question of air pollution, there's been new studies showing that there's been a tremendous benefit economically to the agricultural sector in the US from cleaning up ozone associated with the Clean Air Act. That as all sorts of data sets and analyses come to bear, there's more and more evidence. Now, I think in the case of these CRISPR technologies, it's a matter of making data sets more transparent, more available, and having independent studies of, for example, glyphosate. We know so little right now about exposure to glyphosate. The USGS actually does a better job than anyone in terms of measuring that stuff. But in terms of exposure to all sorts of toxins in food, it's still, I mean, we have a ways to go, but it's better than it used to be, for sure. So that's one area, I think, is gathering the evidence base and making sort of the economic case. I think the other area, more to your point of how things will play out, is that we're living in this world where alternate facts are put on the same sort of table as facts. And I don't, I struggle with that. I don't have a good answer for that. As scientists, I think if you look at the history of climate change, when I was being trained, it was always about scientists need to communicate better. And I think we always could communicate better than we do. But I think what we completely missed was just sort of the Fox News effect on this country. And I don't think as scientists, we really have much of a role in that. But I think as a society, if we can't get facts versus non-facts straight, the work we do, will, in the long term win out because it's reality. But in the short term, in terms of policy, it's going to be very difficult. So I think what I try to do is as often as I can, speak to schools, speak to public audiences about understanding what the facts of these issues are. But mostly it's focused on getting the evidence base there so that when there are opportunities to make good policy decisions, that the evidence is there. But getting to that point, how things play out, it's sort of beyond me.
Vote November 6th. Sorry.
Say it again.
I'll say it again. But Mark, give us your solution. Concrete.
Sorry. I don't know what's, I guess this
They're
is
both
on.
working, I guess.
So I think I can echo what my other colleagues in the whole two panels have said about communicating, working with the media, who is very powerful, we know, and that we're all touched by these issues. And so the leadership has been touched by issues and care about children too. And we just need to harness that and communicate that in a way that they can understand what we're doing and the impacts of what we're doing. The medical community, as I mentioned, so railing around issues and making sure that the medical community and the voice of that and caregivers is being disseminated. I did want to, I tried to emphasize that we are kind of on a technological breakthrough right now too. And so we can look at, in a more comprehensive way, what's going on with kids, with multiple sensors, looking at toxic stress and looking at the very big picture and not just one thing at a time. And then with this explosion of data, we're going to have to be able to explain that as well. So I think we're on the brink of understanding what's going on and what are the major drivers. But then again, we are going to have to communicate that. But we've had very, very good experiences with like Congresswoman DeLauro and working with the media and Consumer Reports, working with the medical community and the American Academy of Pediatrics. And with, as Ricky said, our participants, people care about these issues. And we ask them, and we do run focus groups and surveys, what do you care about? And I've taught in classrooms too. I've gone into middle schools and high schools. And almost every child will have some comment about an environmental agent that's of concern to them. Their nail polish, whatever, their tattoo, And so I think we just need to keep an eye on these emerging things. My one public health thing that I would like, and we have someone here who's at the CDC, is just better collaboration on the data that we have available to us. Sometimes there are barriers between states. My dream is that we would have access across the country to birth records, vital records, and that we can link the data sets that we have without any impediments. And in certain countries, in Scandinavia and other places, the national data is very accessible, and they can conduct epidemiology that does make us a bit jealous, I have to confess. And so I would love to see a future where we can collaborate across states and cities and be able to look nationally at data sets.
Thank you. Questions from the audience?
Can I just add one quick thing? The Climate and Health Forum yesterday the end of it had a call to action for climate and health. I think everyone should see that because it has a very comprehensive, the call to action for climate and health. Yes. That document is fabulous. It has 10 recommended steps for what we need to do in terms of climate
Can we get
actions
that out,
for health
Carrie?
and health actions for climate.
Maybe we'll try to, we have most of you on a list who signed up. Maybe we can get that out to you. Yeah. Another question? I think, did you? Oh. I'm sorry? Yeah, sure.
Well, if you go to the globalclimateandhealthforum.org, there's a link to the call to action. And we're still seeking, we had 55 initial, and I'm Linda Rudolph with the U.S. Climate and Health Alliance. We're one of the groups that organized the forum yesterday and that put together the call to action. So we had 55 initial endorsers, including a lot of medical societies, AAP, the American College of Physicians, the American College of Preventive Medicine, APHA, the National Environmental Health Association, a lot of others, a lot of international organizations, American Lung Association. And we are now seeking additional endorsements from health organizations. So take a look, take it to your organization, and our hope is to just expand the list of endorsers and present it to the world's governmental leaders at COP in Poland. And more importantly, use the call to action to help give all of the people in this room ideas about what are the policies that you can actually work on at a local, regional, state, and national level to really move the needle on climate change quickly, because that's what we have to do. Thanks.
I just want to acknowledge you, Linda. Linda's been the
Let's take actually, can I take someone who hasn't asked a question? I'm sorry. No, it's okay. I just want to give other people a chance.
A few of our speakers, I think, need to
Leave. Okay. Okay. Can I ask one more question?
Sure.
Are you okay? Can you give us your last question? We'll end with this question. Is that okay? If you want to leave.
Oh, no, that's all
okay.
right.
My name is Elizabeth Babcock. I'm with the Denver Department of Public Health and Environment. We're the local public health agency in Denver. And you said get partners involved early. And we're working on an air quality project. We're actually studying air quality at schools in Denver through a grant from the Bloomberg Mayor's Challenge. And we are looking for ways to engage the health research community. So I'm wondering how we would do that, when we would do that. We want to reduce sources of exposure to pollution near schools. And so just any advice you might have, and can I reach out to you
Do you want, can you answer that?
for
I
support?
think we have an answer here for you, and then we're going to.
Try for a second. Let me just do this. There's a reason you're meeting in California. 30 years ago, no one knew what pesticides were being used on any farm, how much, when, total poundage, how toxic, or anything else. It took a collaboration between the health groups, the Academy of Pediatrics in particular, exactly the things that Dr. Rudolph is talking about, where people came together with environmental folks. That led to full reporting of all pesticide use in California. Very academic, right? Turns out it's been enormously important in terms of the studies done at Davis looking at Parkinson's onsets and other such diseases. It's been very helpful for Chamacos and all the work on newborns. So that data set, the second part of that was the California Birth Defects Monitoring Program and having that data in place. No other state has copied such an obvious thing. And in the year of computers, where every farm in the country has a computer and ought to be able to keep track of what they're doing and when, because it's expensive and they pay for it, no other state has done it. And so creating these underlying databases, it's absolutely critical. And this is a big takeaway for all of us, I think. And we ought to also be counting antibiotics in every single farm.
We're trying.
Sorry.
That didn't quite answer your question about schools. Can somebody, does anybody have?
Ricky?
We're measuring air pollution at schools, and a lot of our schools are near roadways, and so we'd love to partner with the health research community. So maybe I'll just reach out.
Why don't you reach out? I mean, there are, obviously, you're going to find experts right in your own area who know, who know how to do GIS, Geographic Information System, placing the school vis-a-vis the highways and the children's residences and so forth. And then the satellite data on air pollution, you can combine that with personal monitoring using bracelet monitors or small backpack pumps. Lots of ways to do it.
The other person, if you want to name another name, is Paloma Beamer. She's Paloma. She trained at Stanford. She's an engineer, and was one of the first people to really be able to was able to tabulate the children's pesticide exposure in households of migrant workers who were. And so she's published a lot of data in that area. She works at the University of Arizona. I think she's still at U of A. Paloma Beamer. And she does work exactly in that area, looking at children around freeways and their risk for respiratory disease.
I think that answers your question. I want to end by thanking all the panelists very much.
Thank you.
And a special thanks to Kari, who really put this together. Good work.
Thank you.
I think that came out great. Yeah, it was really powerful.
Thank you.